Good afternoon. Thank you for joining us for this update on EPIC and referrals to population health. And we're going to touch a little bit about diabetes eye exams and maybe share some good news with you at the end. So let's get started. We want to talk a little bit about making ambulatory referrals to social services or social work. Within EPIC, there is an ambulatory referral order that you would be able to select in order to request social services. As we've learned in the past couple of weeks from our EPIC team, there can be some confusion, some inconsistencies in using some of the messaging boxes. So we're changing our process to route requests for social services, whether it's for behavior health or other programs, as well as diabetes education and nutrition education via the referral process. So this is just a quick review of some of the kinds of services that social work can provide for you. Obviously, medication assistance, community resources, assisting patients with advanced care planning, and as well as helping you with and family members with long-term placement. On the behavioral health side, Amy and Sam do counseling for depression, anxiety, and a few other things. They can assist with grief counseling, as well as connection and resources for substance abuse. And they also do some really good assessments on patients who may need a more in-depth behavioral health referral, and they know some of the places and connections in our communities to connect them. So let's kind of refresh how we're going to do this. Within the order, you're going to place in the order, and you're going to select referrals. Here's a listing of all the different kinds of ambulatory referrals you can make, and we're going to select ambulatory referral to social service or to social work. Once you are into the screen, it's going to ask you for some information here. We're going to enter UPC population health. It may take a little time to get used to entering this data in, but this will automatically route this referral to our referral coordinator within population health. If you leave this blank, it will go to your referral coordinator within your clinic. So please, so we can expedite these quickly, be sure to include UPC population health. We also would like your help in knowing which direction this request, this referral needs to go. Within the department-specific code, just under the department code, you'll see that you can select social services or behavior health with a quick lookup. It's also very helpful with these social work requests to be able to identify the reason why. Are you really looking for advanced directives? Are you looking for transportation? Are you looking for counseling, community resources? This just allows Amy and Sam and the new social worker that's starting with us in about a month to focus in and zero in on the patient's needs. What happens after you do that referral and you put in UPC population health? It will go directly to Alicia in our South Tulsa office, and she will have access to schedules and can get the patient, call the patient and get them scheduled right away, and then make sure that information is updated with our social workers. Social workers will contact the patient, see the patient, begin to provide services, whether they're episodic for just a few connections or whether they're going to be more long-term with counseling. And they will update the record in EPIC so you're aware of what updates may be needed. Okay, we also want to do that same process for our diabetes education team. As you guys know, we have Christy Covey, who is an RN and certified diabetes educator, as well as Katie Canole and Crystal Pelly. We're adding another person to our staff. Her name is Allison Forsythe, and she will be starting with us in a couple of weeks and will soon be available to assist as well. So, similar process. You're going to make a referral for ambulatory referral for diabetes education. And in this area, you're going to select whether you want to have diabetes education or other nutritional services. So be sure to add that in. Again, we're going to ask you to specify the department here. A couple of quick comments. If you specify UPC, we'll cover those in just a minute. It'll give you it'll route it to the appropriate group of people. There's also a field here to enter the diagnoses. Let's talk about the department for just a little bit. We want to be able to use UPC, population health, if your preference is for the education to be done by the CDEs and the registered dietitians within our population health department. Again, that's Christy, Katie, and Crystal, and soon coming, Allison. If you would like, and this is a very appropriate referral to be done as well, to send it to the Hillcrest Diabetes Education Center. As you know, they provide and are one of the approved diabetes education programs. You can select their name specifically in that department field. You need to be aware in EPIC, especially for those of you that are in the rural communities, if you leave that department name blank, it is hard-coded to send that referral to the Hillcrest Center for Diabetes Management. So let's just be aware of that. If you want the patient to be seen at the Hillcrest Center for Diabetes Management, certainly identify it. If you want Katie, Crystal, and Christy, then please specify UPC diabetes, UPC population health. There's also that field for diagnoses. Please enter the appropriate diagnoses so they'll also know what to focus in on. And then once that's done, the same process occurs. The referral will go directly to Alicia. As you know, no prior authorizations are needed. They will schedule the patient directly according to the best time for the patient, whether it be in our office or in your office on their regular visit days within your clinic. And then they will update their records with the patient's progress and then provide contact with your care managers in the clinic to start handing the patient off for continued support. So we can do this now. The system has been built. There was maybe a couple of questions from your office managers. If the department is entered, it will bypass their referral coordinators and go straight to Alicia. The EPIC team may be providing additional tip sheets and instructions in future webinars, but this is pretty basic, and you have some referrals set up in EPIC that operate very similarly. Okay, let's take a few minutes to talk about diabetes eye exam. We've made some really good progress on it toward the end of last year in 2018 and early 2017 and early 2018. So we are restarting our diabetes eye exam effort. As you know, we have eye cameras in various locations, including Pryor, Claremore, Owasso, the Central Clinic, the South Tulsa campus, Cushing, and a float camera at Sand Springs and another camera sharing between Sapulpa and Glenpool. So our goal is to maximize the use of those cameras for helping to get some of these eye exams caught up. So the metric defines our target population as patients with diabetes who are 18 to 75 years old and who has had a retinal or dilated eye exam by a healthcare provider over the last in the 12 months of the measurement period. Just so everyone's aware, the measurement period starts January 1 of 18 and will end on 12/31/18. All of the patients that we had gotten information on the eye exams in 2017, we'll need to make sure that those are updated again with the eye exam in 2018. Here's just a formal definition. So we're looking for patients who have diabetes who are in this age group. They have also had to have an office visit, a nurse visit, a home visit, or a nursing home visit during this measurement period in order for this eye exam to fall into the right bucket. So we'll be working on those pieces together. There's a couple of things that have changed with Epic and the eye exam process. Previously, we were only billing a code 92250. This is the appropriate code for the eye exam, but some of our payer partners, especially our Medicare Advantage plans, were not able to see that code and recognize it as an eye screening. So with Epic, we have tested and are now able to build an additional code of 2022F, which tells the plans that eye exam was done. Just as a reminder of our workflow, once the images are taken of the retina, they are transmitted on an encrypted network to a board-certified retinopathy specialist who contracts with Welch Allen to read those images and provide a report. We receive that back in our office, in the South office, and Alicia Hott uploads those into Epic. You will see them in your work queue. As soon as the work queue is approved by you, that eye exam will automatically update the health maintenance guidelines. For those patients that have their eye exams outside of our clinic, we will request a copy of the report from the ophthalmologist or optometrist, and we can, your office will scan that in, and we can then override the health maintenance guidelines with the new information. We do have floating cameras, 1 to 2, that can be available to come to your clinic on a specific day, and we'll work with you to try to schedule a number of appointments in that same time period on that day so we can help get these done. Okay, so part of this is to retrain the people in the clinics just to make sure everyone is available or, understands the new process. There's a few documentation changes in Epic that we want to make sure everybody is aware of. Next week, we will send out a campaign that's really a contact with the patient to request updated eye exam information. We will do that by probably a letter and by email. Those are quick and easy kinds of things to do, and we get good responses back. The other thing that we're going to start doing is reusing or refocusing on using the pre-visit planning forms that identify that the patient needs the eye exam. And we'll use these stickers that you guys have seen before that highlights the need for an eye exam. It's a great time for the medical assistants in your office is to ask the patient if they've had a recent eye exam. And if so, then to get the information about the name of the provider. We'd like to have that provider name added onto the care team. That's going to help us in the future for expediting requests for eye exams. And if they have not had one, I'm going to ask them if they're interested in scheduling one. I've also forwarded to the care managers and to the providers some videos that may be helpful for both the medical assistants and the patients to review, which discuss the importance of regular eye exams. Step 3 is going to continue to outreach as approaching due dates come from the eye exams. So between now and the end of the year, we'll have a number of people who had eye exams in the last part of 17 that we will need to update. And we're also going to outreach to those eye care providers, especially in our rural communities where you know there are 1 or 2 providers that do most of your eye exams. We want to contact them and work with them on getting that information back into Epic and updated. We're also starting a process to help track. It's a tracking tool. We're calling it a tracking tool. The portions at the top can be changed. The goal numbers will vary depending on the metrics. The metric will certainly change, and this is a mock-up of what Midtown might look like with the diabetes for the diabetes eye exam. We can set the bar at 75%, which is our 4-star HEDIS measure. We're going to record in the first column the baseline number, which is today's number. We'll take that out of FITEL. Right now we do have information flowing from EPIC to FITEL. Unfortunately, all of the old exams in NextGen were not moved over to EPIC. So we're starting over and updating basically a lot of information here. We will then have the week or the month running across the bottom. So this will be week 1, week 2, week 3, and there's 12 weeks of space to track that information. These posters are being distributed to your clinics now, along with some markers to help you identify and manage your progress over time. Okay, a couple of little quick updates on reminder calls. As you know, our reminder calls are made through a system called FITEL. So we have a much more expanded, we're calling it our data exchange between FITEL and EPIC. Our appointments are made in EPIC, includes the patient's name, their date, time of appointment, their appointment provider, the type of appointment they're coming from, their email, contact, phone number, and all that information is going into a file that is created, and 5 times a day, EPIC will create that file. Approximately 30 minutes later, FITEL will pick up that file and load it into their database so that the calls can begin to go out and be made. And shortly after that, any new updates from patients will be sent back to EPIC. And you will be able to see the current patient's response, not only in FITEL, but also in EPIC. As a side note, as a reminder, we want to sign up as many patients as possible for MyChart. And the patients have an option of confirming their appointments via MyChart. So patients' responses, we can summarize that already, are going to be in FITEL and will be sent back to EPIC throughout the day. If the patient, here's the important note, if the patient has canceled their appointment in FITEL, that FITEL will send the cancel status to EPIC. When EPIC receives it, they will cancel the appointment on your schedule, and you will see it as a canceled appointment. So a couple of things to consider as we're trying to manage this. FITEL will always show you for tomorrow's appointment or for specific dates what patients have confirmed their appointments, what patients have requested a reschedule, which patients have canceled their appointments, and which patients have not yet confirmed their appointments. We're working on a no-show project now that will standardize the workflow for office managers and for our staff as well. And we will hope to begin training on that in the very near future. EPIC also has a department activity report that will list those patients who have canceled their appointments, and I'll be sending out some specific instructions to the office managers. But basically, your department reports are here, and then you're going to want to add into any of your reports the appointment confirmation status. And it's basically a green check box that says that the patient has confirmed their appointment. Okay, so here's the good news I promised you for the end of this presentation, is that when we began our transition from NextGen to EPIC, we had planned to move a number of pieces of data over out of NextGen into EPIC. We did move colonoscopy reports, but the decision at that time was made to move 2014 forward. So 2014, 15, 16, 17, and the 2 months of 18 were moved into EPIC. But as you know, the metrics, the time period for colonoscopies is 10 years. So by the end of the week, by Friday, the NextGen team has been working on creating the files that would cover 2013, 2012, 2011, 2010, 2009, and part of 2008 colonoscopy reports to move over into Epic. It's supposed to occur on Thursday and Friday. We're going to confirm it with the Epic team. We will let you know on Monday when that is done. So that's good news. We should see better colonoscopy reports in Epic, and you should see some metrics update as well. Okay? I want to thank you guys for joining us again. Have a great afternoon.